Moving on now to the coronavirus pandemic. In New York State, the statewide 7-day average is steady at 1.6%. Positive cases are down, actually. Hospitalizations, though, up slightly. In the city, new cases are up over 600 for the third straight day. The more significant number, though, is the positivity rate. That ticked up to 1.81% today. And remember, indoor dining is reassessed when that number hits 2%. City officials are eyeing a new hotspot, deploying resources to attack an uptick on Staten Island. The positivity rate is above 3% in 2 zip codes on Staten Island. News Source John Chandler is in St. George with what the city is doing now to bring that number down.
Cases of coronavirus in Staten Island are climbing, and the city is taking action.
Not something that would trigger restrictions, something that we think can be handled quickly with a lot of community involvement.
The focus is on 2 specific zip codes where positive case numbers have topped 3%, 10305 and 10314. Those East Shore and Mid-Island neighborhoods aren't facing restrictions yet, but they will see more testing, tracing, and PPE distribution. And handing out masks here, say some, sure can't hurt.
Over here, you still see some people that doesn't wear masks, but, like that one right there.
If you're walking down the street and there's nobody else on the street, people get lax about it and they stop wearing them. And they pull them down and then they're too lazy to turn it back up when they pass somebody.
The line grows at this testing site where most had heard of the mayor's warning this morning.
When these things increase, the most vulnerable people are eventually going to be affected. Old people and nursing homes, I'm worried about that.
The city has added 10 new testing sites around Staten Island, with more rapid test sites coming. The aim is to apply methods to reverse the rise similar to what worked with hotspots in Brooklyn and Queens.
This is different than what we saw in Brooklyn and Queens, which were extended areas, interconnected areas, a bigger phenomenon, a bigger trend. This is more isolated.
One of those new rapid testing sites will be set up here at the ferry terminal with results in about 15 minutes, and one positive test would then mean immediate contact tracing. We're in the St. George neighborhood of Staten Island. I'm John Chandler, News 4 New York.
Well, in New Jersey, Governor Murphy says he's close to ordering some new restrictions to stop the spread of COVID-19. It comes as the state is reporting another day of new cases above the 2,000 mark. 12 new COVID-19 related deaths were also reported. Now, the statewide positivity rate is now close to 8%. That's a number Murphy says is troubling.
Close. So bear with us. We will clearly be taking action. And I hope it will be action that balances all the various challenges and interests that we have.
All right, so where are they focusing? Well, the state's focusing on 4 hotspots: Newark, Elizabeth, Lakewood, and Atlantic City.
In Connecticut, Middletown's launching a pilot program to offer free rapid testing for students and staff. The school district is offering the testing with the help of the state and Middletown's Community Health Center. This program is the first of its kind in Connecticut. The state's education commissioner says dozens of districts are watching Middletown with interest to see how effective this program is there.
Well, Jersey City now rolling out a new Mask Up JC campaign to make sure every resident has a mask. This initiative includes a mass mailing of 5 city-branded masks that will be sent to all 120,000 households. The package would also include a letter from the mayor encouraging everybody to sign up for the city's emergency alert system. The city would distribute 2,000 stickers, too, to local businesses that read "Mask Up" to enter. So they're